Hi, my name is Blake. I was introduced to Dr. Soham through a friend who happened to already be engaged and working with him, and he just offered up just great reviews through the successes he's been having, and I decided to meet Dr. Soham and get an idea of what it is that he could offer for me. At that time, I got in touch with him, and he provided a free consultation, which was a great start, and started giving me some insight into what it is that he does. So as a result of, I ended up coming in and scheduling an appointment, and we took our initial x-rays and exams. And to preface, I think I should say that I had no pre-existing conditions. I wasn't in pain, but after talking with him and getting a better understanding, I decided to come in anyways, just to get an idea of what exactly is going on with my body. Am I truly where I need to be for long-term health and success? And it was a small price to pay to have that knowledge. So coming in, we took some x-rays, and I was able to see a tangible, real, just visual representation of where my body was at. And I'm going to stray from getting too much into specifics, but it's specific to the alignment and positioning of my head as it relates to the rest of my body. And what we found is that it was not in alignment. In fact, there was a decent sized variance, and therefore I decided to move forward with some treatment. One of the big draws that brought me in, not having pre-existing conditions, I wasn't in pain, was there was a possibility that as a result of what Dr. Soham offers, gaining alignment would have a positive effect on some of my mental capacities, specifically anxiety, and I have trouble sleeping. So I was intrigued. I didn't understand how chiropractic efforts could help my mental health. It was super intriguing, actually. So I came in, we did the x-rays. It was made clear that I was not in alignment, and we moved forward with an adjustment, and I signed up for the full plan. And I think it was 10 visits, or every 3 weeks, super manageable. I work full time. It didn't impact my schedule that much. And Dr. Soham was super flexible and worked with my schedule, which I appreciated. So we began the adjustments. The first adjustment was shocking. Again, not at all what I expected. I expected, to be twisted and bent, 10 different ways, and it was none of that. In fact, it was very subtle. In fact, I didn't even realize it had happened until it was done. It took about 5-10 minutes, and then we went back, we did x-rays again, and already immediately I was well within the preferred range. And as I learned through questions and what was offered, it's then a question of holding. So this is when the evaluation process started. So my first adjustment was done. Okay, now Blake, you go home and let's see if you can notice any positive impacts. And the answer is yes. So my sleep improved almost immediately. The anxiety was, a little bit harder to evaluate, but as we progressed through the whole process and future adjustments, I can confidently sit here and say that it has improved, which is huge. I work in a very stressful industry, and anything helps. And this is the most natural and pure way. So it was great. So yeah, it just then became a matter of holding. How long will this adjustment hold? And after a lifetime of being out of alignment, or maybe not a lifetime, but a large portion thereof, your body gets used to being a certain way. So the adjustment happens. The only thing I would speak to that is, a couple of periods or times after, I believe in total, I've had 10 visits now, or close to. I've only, I think, had 2, maybe 3 adjustments, and I've held now for months, which, as I've come to understand, is pretty good. So I was super happy about that. But yeah, it's just after these adjustments, there's an adjustment period, I'll call it, those are my words, where, I felt, it felt a little insecure, a little weak, because my body hadn't adapted yet. It hadn't adjusted to the new alignment. And I can specifically remember, and this happened now about a month ago, right? And the only time I really noticed it is when I was sleeping at night and my head was on the pillow. If it wasn't perfect, I felt everything strengthened. And now, since I just had a visit a few days ago, and I'm still holding, and I feel secure, it's holding, and it's great. The mental health thing was a huge draw for me, but also the preventative health was the other thing, right? No existing ailments, no soreness, but I'm getting older. I'm 33, getting ready to turn 34. I've been in generally good physical health most of my life, but, as I focus more on my work and, friends and the rest of my life, it's gotten a little less focused than it used to. So I'm not as strong as I used to be. And I know as I age, it's a very much more so a consideration than it used to be. Just preventing what could potentially become a major issue down the road. And I'm not a small guy, so being out of alignment, at the time I was heavy on my left side, and my knees, are fine, but they are not the greatest. And I can only imagine the issues I could have potentially had, in 2 years, 5 years, 10 years, if we didn't take this corrective action now. One of the things that we do when I first show up is there's 2 scales, and I stand on the scales, right? 1 foot on each, and I look straight ahead. And by doing so, Dr. Soham is able to evaluate, how disproportionate I am, if I have an even distribution or not of my weight. And that, through the process of visits and adjustments, went from a 5 to 10 pound variance to a, 0. And that's tangible. I don't care who you are. I look at that, and I that's tangible evidence and results of improvement, pain or not. So, I know I'm getting something out of it. That's it. It's just, I've got nothing but great things.